My name is Isaac Shongwe from South Africa, and I'm one of the founding members of the Africa Philanthropy Forum. This morning we were supposed to have been joined by the Minister of Health, Dr. Admasu, but unfortunately the Minister could not join us. However, it is my pleasure to introduce to you Dr. Kebede Worku, who is the State Minister of Health of the Federal Democratic Republic of Ethiopia. Dr. Worku, thank you very much at short notice to agree to come and share some words of wisdom with us. Welcome, sir.
Good morning. Welcome to Addis Ababa. On behalf of the Federal Minister of Health of Ethiopia, and on my behalf, I feel privileged delivering a speech on this important African Philanthropy Forum. As you all know, health is human right. Apart from that, healthy development shall be seen not only in humanitarian terms, but also an essential component of social and economic development, as well as being an instrument of social justice and equity. Vision of Minister of Health of Ethiopia is to see healthy, productive, and a prosperous society, to indicate importance of health and wealth creation on top of meeting the definition of health. As a country, Ethiopia has excess labor force and a farmland that needs healthy labor, the healthy labor force. Likewise, in urban settings, healthy labor is necessary in all space or economy. Health is also about human development that contributes to sustainable growth, and healthcare must be done in a manner that makes best use of resources in the context of good governance and enhanced accountability. I will give you some information about health sector in Ethiopia, giving emphasis to community health services, the health extension program that was introduced and expanded since 2004. This program ensures universal access and equity to health promotion, disease prevention, and the basic curative services, along with basic rehabilitative services at community level, focusing on households, maternal and child health, communicable disease prevention, and the environmental health package targeting health problems that can be prevented and or easily treated. These services are integrated and provided by health extension workers. Health extension workers are all females, high school complete, recruited from local community, and trained for a year in a technical and vocational training institutes, collaboration between the Minister of Education and the Minister of Health. Why females? Females have community acceptance and the ease of communication at household with mothers in traditional societies like ours. More than 38,000 health extension workers have been trained and deployed so far, and these frontline health workers are all on government payroll, are permanent civil servants, and the 2 health extension workers are assigned in each health post, serving about 5,000 people, and the 1 health center serves about 25,000 people, and the supervises 5 satellite health posts that constitute primary health care units. There has been accelerated expansion of these health facilities. We do have about 16 health posts and the 3,250 health centers, all run by the public sector. Community engagement is also critical in implementation of the health extension package. Demand creation and the utilization of services offered by health extension workers and the community participation. Households are networked, and the moderate households are providing support to their fellow neighbors to scale up best community services. And Health Development Army. Health Development Army is a system of organized community movement using different women groups from federal to local community that engage community in double local interventions and transforming the society in ways that ensure sustainability of service delivery. There are demonstrable results in areas that have best used the approach. Increased trends in skilled birth attendance, immunization services, family planning user rates, household sanitation and hygienic practices, local response in HIV/AIDS activities, reduced adult HIV prevalence rate, and reduced new HIV infections by 90%, and the incidence of TB has also dropped down by 50%. Increased nutritional service coverage, significant decline of morbidity and the mortality from malaria and HC. Ethiopia has also reduced its under 5 mortality by 2/3 between 1990 and 2012 from 204 live births per 1,000 live births to 67 per 1,000 live births. And there's a required reduction for meeting the targets for MDG 3 years ahead of 2015. And this is great news and a milestone in our effort to save precious lives. About 42% of under 5 deaths are attributable to neonatal deaths, that is closely linked with maternal health. Of course, we have reduced maternal mortality ratio by about 64% from 1990 to 2011, as estimates by the UN Interagency. Reducing maternal mortality is challenging, as rates of institutional deliveries are not increasing as we expect, but we have positive hope that it will improve dramatically as access to services are universal, and we availed 4-wheel ambulance to each district and addressing attitudinal and cultural bottlenecks through community mobilization. There are some communities that have registered 0 home deliveries since introduction of Health Development Army. In order to address child and neonatal health at community level, we have introduced integrated case management system, and we are also introducing community-based newborn care as part of health extension program. Partnership in health matters a lot. Many of the achievements in health sector in Ethiopia are results of partnerships that we have established over the last decade. Ethiopia is a signatory of Global IHP Compact in London in September 2007, and thereafter we have prepared our own IHP roadmap and the compact and signed joint financing arrangements with multilateral and bilateral agencies that has established MDG Performance Fund to finance priority health interventions that lack global attention, particularly maternal and child health and health system strengthening. As it was clearly stipulated in 2008 Accra Declaration, mobilizing public and private financial resources for development is an integral element of global partnership for development. I would like to express my sincere appreciation for philanthropic organizations for supporting humanity in the world. They don't have legal obligation, but moral obligation that has made them share their own resources in investing in communities. One may not see many philanthropic organizations as frontline implementing partner or financing institutions, but local and international NGOs that tap resources from these philanthropic organizations and individuals and contribute to local service delivery mechanisms. One can also see contribution of philanthropic organizations in global initiatives like Gavi and the Global Fund, from which Ethiopia has benefited a lot. I can mention some of these philanthropic organizations who are contributing to Ethiopian health system. I don't mention the ones that doesn't want to be identified. Bill and the Melinda Gates Foundation is supporting our health system in general, particularly reducing maternal and child mortalities and immunization. Packard Foundation is also supporting family planning, and that has also been supporting population environment. Children's Investment Fund Foundation, that's also working on maternal and newborn care and the strengthening health system. Clinton Foundation, that also works on maternal health, child health system strengthening, particularly hospital reform and HIV/AIDS program. And we are also discussing with, I don't know whether they are here or not, and I would like to talk in person, Elma philanthropist, to establish a child hospital. They have been in discussion with the minister, and I would like to meet in person. I may not have full list, but once more, thank you all for the partnership you have extended to people in the government of Ethiopia. Though not developed as we expect, there are few private investors that are developing healthcare facilities as corporate social responsibility. I would like to quote what Mr. Bill Gates said on Gavi board meeting in New Delhi in 2008. Investment in health is low-risk investment. I think you all joined such high moral cause during philanthropy, investing in public health to give opportunities to mothers, children, and the larger public to enjoy healthy life and to contribute their roles in social and economic services. Investing in African current youth generation will pay back in economic terms. Still, there are segments of communities that lack access to basic health care due to financial barriers, and your extended support in this regard is also important. You better understand how to become successful in business management, entrepreneurship, and leadership. I would like you to focus on need-based and the joint planning and monitoring evaluation, giving due attention to local capacity building and sustainable service delivery, scaling up best practices, and contextual adaptation is also necessary. Support operational and some basic research that can enhance utilization of African potentials, reducing transactions. As Ethiopian, joining the MDG Performance Fund, and supporting NGOs that with good track records, and supporting pastoral sales service delivery, where we are not registering adequate and demonstrable results. I would like to call upon all philanthropists to scale up investment in social goods in Africa and Ethiopia to improve health status of our population. Thank you very much.
Thank you, Honorable Minister, for your remarks this morning. I wanted to ask you a question on how you combine your national strategy with philanthropic support to invest in the health sector. If you could just give us a few examples of how you work together. Thank you.
Let's just take two quick questions. There was another hand over there.
Thank you very much. We had earlier in this morning an interesting discussion about the appropriate role of philanthropy and aid as well. And Ethiopia uses...
Can you speak up a bit?
Ethiopia receives a lot of resources from the Global Fund for AIDS, TB, Malaria, the Global Alliance for Vaccines and Immunizations. How has Ethiopia used those resources differently, perhaps, you think, than maybe some other countries in terms of its allocations? Thank you.
One last question, quickly. We'll just take those two questions.
Thank you for the questions. We have a national planning process. We have we set targets with regional states. In our country, we are a federal government, and we call the states regional states. In some other countries, they may be called also provinces. So we set targets based on the 5-year strategy plan, which we call Health Sector Development Program. And once we set a target for the fiscal year, we do consultations with the local administration. In our case, we call them districts or waradas. And this will be summed up at regional level and also compiled at federal level. So we do have a national planning process. And in this process, we are engaging all partners, multilateral and local NGOs involved in the sector. And most importantly, as I said earlier in my speech, we do have a partnership forum between the Health Population Nutrition Forum and also our ministry. And we set targets jointly, we review it, and we also conduct joint review missions, and we base all this to develop our plan as an integral plan. So we do have one national plan, And we are working to ensure one national plan, one budget, and one report. And it will be difficult to have one budget in one pot, but in the process we need to account for all interventions that we are undertaking by different actors. So it is not only the public sector that acts on the ground, but also private and NGO sectors for not for profits. So we see the contributions. We also do resource mapping on annual basis of contributions of these development partners, and also at global level we have consultations like with the Gavi and Global Fund. I don't think whether we have used it differently or not, but we have used it wisely in addressing to our priority areas. HIV, malaria, and TB are our problems, and there were times that we lost hope, particularly for patients with HIV/AIDS, until we started the free ART program supported by Global Fund and PEPFAR mechanisms, and these have given us hope and enabled us in reducing the new infection by about 90%, and there is a prevalence of HIV from close to 6-7% to almost 1.5% in adult population. So we are using in priority areas. We have started also joint national plan development in consultation with global IHP and other initiatives. So I don't know whether we have used it differently, but we have best used it, and we will continue using it. So trust upon us.
Thank you, Minister.